OCD. Three little letters, one big meaning. What is OCD? OCD is obsessive-compulsive disorder. It is a brain disorder that affects behavior. It is a mental illness. It causes severe anxiety. It's characterized by obsessive, intrusive, unwanted thoughts that come into the mind with no control of the person who has them. That's the obsession part. Compulsions are what people who have OCD do to relieve the obsessive intrusive thoughts and anxiety. So a person who is terrified of getting sick will wash their hands over and over again because they feel contaminated or like they have germs all over them. That's a classic symptom of OCD for germaphobe. There are other various forms of OCD: counting, checking, harm, relationship. There's just too many to go into right at this particular point in time. This video is just to talk about what OCD is, common misconceptions, how it affects a person, what causes it, and learning to talk openly about it, which is what I'm trying to do. 26 times now I've tried to record this video and my son has come out here and he's had problems with his tablet and I've had to stop and start over again. So, common misconception is not everyone with OCD washes their hands or counts things or checks things. My particular flavor of OCD, I don't do those things. I mean, I wash my hands like a normal person. I make sure my door is locked before I go to bed at night, and I might count to make sure I have enough, gallons of milk to get through the week because my kids suck it down like crazy. But outside of that, I don't have those types of compulsions because that's not my subtype of OCD. I'm not going to go into my particular subtype of OCD until probably like video 6, if I can even get through video 1. So we'll see. For me, it started in, well, let me go back and say OCD can present at any time. It can start as a child, or you can have it onset later on in life. I was 29. I'm 30 now. I've been dealing with it for just a tad over a year now. It started in March of 2014 for me, and I really thought I was going crazy, like legit. I told my husband I felt like I had crazy in my head. I mean, we had no idea what was going on. I didn't know how to express it. I was scared, terrified, scared. Like, I didn't know what to do. I had no clue what was going on with me. It wasn't until October, because I've been in therapy. So it wasn't until October when it all came to the point where I just couldn't deal with it anymore. I just couldn't take it. So I finally told my therapist what I was dealing with, what was going on in my head. And she tells me, I think you have OCD. And I'm like, okay. I don't wash my hands obsessively and I don't count check things and, And she said, well, there are many different types of OCD. Are you aware of that? I was like, well, no, because that's not what you see on TV or radio or whatever. So, yeah, there's like a ton of different versions and varieties of OCD out there. There's so many. I mean, the research is just, it's unbelievable. And they're finding more and more people have OCD each and every day. A lot of people don't realize that that's what it is, especially when they present the way that I did. They really just think they're a psychopath. I'm not a psychopath. I love my family and I just want to be normal. And it affects everyone differently. No one knows what causes it. Genetics, environment, combination of both. Obviously, if you have a family history of mental illness, your odds of having a mental illness are higher. Does that mean you'll get OCD? Maybe, maybe not. It's like 50-50. You could end up with bipolar, you could end up with anxiety, you could end up perfectly fine. It just all depends. It's a chemical imbalance in the brain. It's caused by not enough serotonin making its way into the serotonin is a neurotransmitter. It has to make its way around into the areas that it needs to get to, and when there's not enough serotonin, then it can cause different things like depression and bipolar, and in my case, OCD. You're gonna see my cat in a minute. I think he's gonna jump up on the couch. No, you can't see him. Oh, anyway, so, we don't know for sure what causes it or what starts it. So in October, I told my therapist about it. From October until about a week ago, I tried to deal with it on my own. My therapist did CBT with me, which is cognitive behavioral therapy, mindfulness, being mindful, being in the moment, focusing on what's in the moment, using the art of distraction, distracting yourself from what's in your head and focusing on what's going on out here, like right now, and not allowing what's in here to really bring you down. Unfortunately, that only worked for me for so long before it just didn't work anymore. Triggers are really hard. We'll get into triggers in another video. But for me, it seemed like everything was becoming a trigger. So I had to do something, and I knew that there was only one other option for me, and well, two options. I could do ERP, which is exposure prevention response therapy. No, exposure response prevention therapy. Sorry, got that a little mixed up. I was not, still am not at a point where I can do ERP. So I chose the other option. I chose to see a psychiatrist, private psychiatrist, whom I adore. He's awesome. I'm not going to mention his name on here because I don't want to get sued, but he's amazing, and I love him to death. He put me on 3 different types of medication, which I'm also not going to reveal on here because medications work differently in everybody's body, and I would prefer to keep some of my things personal. But the medication that he put me on works. They say it takes 2 to 8 weeks before you see results with medication. Within 3 days, I felt better. Some of the side effects suck. I'm tired all the time. I just want to sleep. Well, unbalanced and coordinated, but you find that with almost all psych meds. They make you sleepy. It's just, you have to ride it out. That's what everybody keeps telling me. Just ride it out, just ride it out, just ride it out. Don't stop taking them. I'm not going to stop taking them. I feel better. Why would I do that? Why would anybody who feels like crap take a medicine and then stop taking it once they feel better? No. I will take these medications for the rest of my life if I absolutely have to, because I kind of feel like a normal person now. Like, it's still there. It's nowhere near as tense, like intense. I want OCD to be something that's talked about openly. I don't want OCD to be something that people look at you like you're looking for attention. You just want attention. You just want people to say, oh, hey, look at me, there's something wrong. No, I'm not that kind of person. And I know, like, posting this YouTube video probably screams exactly the opposite, but my thing is, where do we separate look at me to let's raise awareness? Like, there needs to be awareness raised for a lot of things, but I think the stigma behind mental illness, I think that one is really important, especially to those of us suffering. Mental illness isn't just all in your head in the sense of you are being dramatic and want attention. I don't want attention. I just want to lead a normal life. I want to raise my family and do my job and take care of my home and love and be loved, just like any other person in this world. And there's no reason why we shouldn't be able to have those things just because our brains work a little bit differently than other people. And so I'm going to close now. I've got about 45 seconds left on this video. Each one will be about 10 minutes, give or take. Let's talk about it. Comment. Ask me questions. I'm not going to lie to you. I'm not going to sugarcoat it. I'm not going to hide things. I really want people to know what mental illness is, and not just OCD. I chose OCD because that's what I suffer from. But if you have questions about other things, ask. And above all, know you're not alone. You are not alone. You are so not alone. Absolutely. You're in good company. Thanks.